Thank you, Madam Chair. Leadership is what America is now looking for. They're looking for a strong, consistent, honest voice from the NIH, from the CDC, the FDA, and from the White House. And frankly, Dr. Fauci, a nation is turning its lonely eyes to you for leadership. Let's talk about schools for a second. I think you all know and agree with me, our schools, our youth are in a mental health crisis. Our youth are suffering from increased instances of suicide, substance abuse, overdoses, depression, a true epidemic. And this was very predictable for all of us from the healthcare field, that when we close down schools without the social interaction, we'd see increased mental health crisis. Totally predictable. Let's talk about the science of viruses for just a second. As a private practice OBGYN for 25 years, I would tell you that viruses are predictably unpredictable. That how they impact a non-pregnant versus a pregnant woman certainly is different. And what I feel like when I try to listen very hard to you all is that the little science we do have is being presented as dogma, as gospel, and we know it's not. It's anecdotal at best. All I've heard so far today is basically anecdotal experiences. When it comes to schools, we need to hear a stronger voice from you all, from leadership. We need to hear a stronger voice, not a wishy-washy voice. And Dr. Fauci, I would ask you, do you agree with me that the benefits outweigh the risk of getting children back in school? Will you tell America we need to get our kids back to school?
I have said that repetitively. As you know, you've obviously been following what I've been saying. I've been saying the most important thing we need to do is to try as best as possible to get our children back to school safely. And that's exactly what I've been saying over and over again, right in this room in previous hearings. I think the chair has heard me say that multiple times.
Based upon everything we know about the virus, the epidemic we have now, do you feel the benefits outweigh the risk of getting children into schools across America?
Well, I mean, if you listen to the CDC's recommendations, that's exactly what they're saying. They're talking about the benefits versus the risk. And as you know, their guidelines are trying to get people to follow guidelines that will get the children back to school with the minimum risk.
I was hoping a yes or no answer, but I'll move on to mask. One mask, two masks, oh me, oh my. You know, President Biden recently said that we should all wear masks until everyone is vaccinated. That's probably the worst thing that could have been said for compliance. So many people have said, why would I go get a vaccine when the president says we have to keep wearing masks until everyone's vaccinated? We Americans feel like the goal line keeps moving. And I understand your fear of different variants and all those different things going on here, but where is the science that clearly shows wearing masks is helpful after you've had the vaccines? And for the sake of time, I need to move on, but all I've heard, I've heard the question asked already, and I've heard anecdotal evidence, but I would love to have you all send me the studies that show that it is absolutely beneficial to wear a mask after you've been vaccinated or if you've had the virus. And we all want to know, you know, where is the goal line? When can we stop moving masks? I want to talk about the border, though. That's what I'm really concerned about. I just visited the border. My third trip there. It's certainly a humanitarian crisis, and I'm sure anyone that's been down there would agree with me that it's a national security crisis, but I want to talk about the healthcare crisis going on there. When I went down with a group of physicians 3 years ago or so, I was concerned about just the doctors, the nurses being overwhelmed. I was concerned about tuberculosis, hepatitis, scabies, sexually transmitted diseases, and other communicable diseases. But now, based upon what we know, the incidence of COVID is 5 to 25% of the people coming across the border. And then what I see is they take a group of folks, 50 to 60 people, they put them on one bus, and they do a couple of exams, and they all put them in some type of a dorm setting. So if they all didn't have the virus, they soon will, and then we let them go out into the public. That just seems hypocritical. You know, the application that you're talking about for when we can let ships come to Alaska, and the concern about variants from South Africa, that just seems hypocritical to me. While I respect completely where you're coming from, it seems like it's a double standard. Dr. Fauci, are you comfortable with what we're doing on the border from an ID standpoint?
The reason I would have to hedge on that, because I'm not really very deeply familiar with the details of what's going on at the border. And that's perfectly honest with you, Dr. Marshall. I really am not familiar enough with the situation at the border to be able to make a comment. If I was, I would.
Whose job is it to know that?
I can chime in and say that I am aware that at CBP sites that there's overcrowding and that we need to, from an infectious disease standpoint, from a COVID standpoint, we need to de-densify what is happening at CBP. We have been working closely with ORR as our children leave CBP and move to the ORR sites to work towards getting them screened and tested, which is why they have, you know what % positivity they have there. Those ORR sites are much improved compared to the CBP sites with regard to how those children are cared for, who is caring for them, and we are providing technical guidance on those ORR sites to work to make sure that they are as safe as possible using mitigation strategies at their
But do you see the hypocrisy in what we're doing to America? We're saying that I can't have a barbecue with my entire family on the July 4th. I can't have Easter service worship together. But we're going to let people come across the border in mass numbers and just release them into, does that not seem hypocritical?
I think there are two different situations that we have to handle in two different ways. And we have guidance and strategies for how we're providing technical guidance for the challenges that are occurring in the density at the border. And then we're trying to keep the public safe using evidence-based strategies there. Thank you.
Thank you. I yield back.
Thank you very much. Senator Rosen.
Thank you, Chair Murray, Ranking Member.